Recording in progress.
1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
A united community.
We may not be blood related,
but we Patriots are one big family.
Being part of the PWU community strengthens us.
Through the years, we support each other through good times and bad times.
We Patriots always have each other's back.
It's a big honor to be part of a community that is open to the idea
to excel and be the best version of ourselves.
That's the standard of excellence that we Patriots strive for.
I'm thankful that this community lets us be who we want to be.
We thrive because we accept each other for who we are.
And like a family, we treat each other equally.
Actually, PWU gave us a home and helped us to be a patriot in society.
We may have different individual drums and instruments,
but we march to the same beat together as one united community.
Do you want to march with our community of patriots?
I am a patriot.
I am a patriot.
I am a patriot. I am a patriot.
The way you start your day can affect your whole day. Begin it with a smile, calmness of mind, the coolness of emotions, and a heart filled with gratitude. Good morning, ladies and gentlemen. Welcome to the webinar Trends in Nursing for 2023 Updates in Critical Care Nursing on this third day of March 2023 via Zoom conference application. For those who still want to register for today's webinar, or if you have friends who still want to join us today, we are sending the registration in the comment section, or you can also scan the QR code provided by our presentation. But before we start, here are some rules to be observed during our webinar. If you have any questions, use our chat box or comment section. Do not forget to fill up the evaluation form that will be given at the end of the program. Again, a pleasant morning to all. I am Miss Rose Ann Gutierrez Hilao, a registered nurse and a professional teacher at the Tomas Claudio Colleges, your master of the ceremonies. Before we begin, I would like to thank everyone for being with us this morning despite your busy schedule. Today, we will be learning a lot from this seminar. So, what can we expect from this webinar? On successful completion of the webinar, the participants will be able to distinguish the numerous challenges in current trends in nursing for 2023. To enumerate specific competencies required for the delivery of nursing care in critical care nursing. Provide a basis for the assessment of continuous staff development need in critical care nursing. Before we start this endeavor, let us begin this program with a prayer to be followed by the national anthem. May I request everyone to bow your heads and feel the presence of God, led by Mr. Fernando M. Velarde Jr., a general duty nurse at Air Force General Hospital.
Let us bow our heads and place ourselves in holiness of God the Father, the Son, and the Holy Spirit. Dear Almighty and ever-loving God, we glorify and thank you. You have showered us with so much blessings, and your presence continuously reminds us of your faithfulness and guidance. May we humbly ask you to bless our speaker today of your greatest inspiration, so he may share his knowledge and heart and soul to his lecture on critical nursing. May we also absorb the invaluable knowledge and experiences and put it into practice what we may learn today. We pray that you bless all in charge, that we may be able to fulfill our tasks responsibly that the objective we have set may all be achieved. Your infinite blessing would mean the success of this webinar, and may we be living witnesses of your genuine love through the enactment of the knowledge acquired in this activity. We ask this in the name of Jesus Christ, our Lord and Savior. Amen.
Kayang magiliw, pero saan silanganan? Alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyat ka ng magiting. Sa manlulupig, di ka pasisiin. Sa dagat at bundok, sa simoy at sa langit mong bukaw. May dilagang tulad, awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagdiligdig. Ang bituin at araw niya kailan pa may di magdidinig. Lupa ng araw ng at ipagsinta mo'y langit sa piling mo. Aming ligaya dapat may mga kami ang mamatay ng dahil sa'yo.
To give us an opening remark, may I call in the nurse supervisor at Valenzuela Medical Center. Ladies and gentlemen, Miss Liza E. Demission. Let's give her a virtual applause.
Nancy Aganon, our Dean of Graduate School of Nursing, Ma'am Minerva Budeala, our Professor Mark D. Santos, classmates, guests, good morning. ICU nurses are another name for critical care nurses. Critical care nurses work long hours and deal with various challenges when caring for ICU patients. They care for patients who are seriously ill and unstable, necessitating more frequent nurses assessment, as well as the use of medications and life-supporting technologies. ICU nurses use their specific skills to care for critically ill patients, many of whom who are on the verge of death, and to sustain their life support system. In this webinar, our guest speaker, a former critical care nurse, will talk about the current developments in the field of nursing. It is a pleasure for us, postgraduate nursing students of the Philippine Women's University, to have you all participate in this webinar. Regards and welcome.
Thank you, Ms. Demission. The webinar would not be possible without a person who shares knowledge and expertise. To introduce our resource speaker for today's webinar, may I call in the emergency room nurse at Hospital ng Binyan. Let us all welcome Ms. Tracy L. Kasubuan. Let's give her a virtual clap.
Good morning, everyone. Today, this task of introducing our guest speaker is a great privilege. We are so lucky that he really found a way to be with us today, despite of the distance and his hectic schedules. Our speaker graduated Bachelor of Science in Nursing in Centro Escolar University on March 1997 and took up Masters of Arts in Nursing as cum laude in University of Santo Tomas on March 2004. He also took up Master in Business Administration in Health in Ateneo de Manila University and currently pursuing dissertation writing of Doctor of Philosophy in Human Resource Management at the University of Santo Tomas. In line with our theme for today's webinar, which is Trends in Nursing for 2023, Updates in Critical Care Nursing, our speaker has been a staff nurse, charge nurse, head nurse to nurse supervisor in the intensive care unit and acute stroke unit at the Medical City, Philippines from March 1998 to July 2006, and have been in the same institution as nurse manager in the same area from March 2008 to February 2013. He is a nurse educator in the Neuroscience Center in King Fahad Medical City, Riyadh, Kingdom of Saudi Arabia from November 2006 to October 2007, and has been the Director of Nursing from October 2014 to December 31, 2020, and currently the Chief Nursing Officer of the Medical City, Philippines. Throughout his career, he has amassed several achievements, and I'll tell you that if one takes a closer look at the alchemy of achieving person, two distinct virtues pop up: perseverance and hard work. Our speaker has undergone specialization, training in stroke management at Tan Tock Seng Hospital and National Neuroscience Institute in Singapore in April to May of the year 2000, and was also invited as speaker to the international conferences, local conventions, trainings, and seminars such as First Saudi Stroke Nursing Symposium in Riyadh, Kingdom of Saudi Arabia in September of 2005. He is also involved and participated actively in 2 patient safety projects of the Intensive Care Unit and Quality Team of the Medical City, where it won as winner for Excellence in Patient Safety Project on Code White or Rapid Response System Hospital Management Asia Awards in 2011 in Singapore, and winner for Excellence in Patient Safety Project on application of an automated monitoring system to increase hand hygiene compliance in an intensive care unit, Hospital Management Asia Awards in 2013 in Thailand. He was also the national president of the Association of Nursing Service Administrators of the Philippines, or ANSAP Incorporation, into 2022. And now, ladies and gentlemen, please help me in welcoming our guest speaker for today, Dr. Ferdinand P. Aganon. Let's give her a virtual round of applause.
Right. Thank you very much, Ma'am Tracy, for the kind introduction. So I will now share the slides. Okay, I hope the slide is now seen clearly in the monitor or screens. Can you give me feedback, Ma'am Tracy?
Yes. Yes, sir.
All right. Thank you. All right. Okay. As courtesy to Ma'am Tracy, yeah, I am still taking up my PhD in human resource. So I think just call me Ferdinand for now, and hopefully soon, doctor, when we will be conferred the degree. No. All right. So thank you very much to the Philippine Women's University and also to the Graduate School of Nursing for this opportunity again to join you in this webinar. Before I continue, I would like to acknowledge, of course, Ma'am Tracy for her hard work as well as the group, the masteral students. I know there were a lot of exchanges on the schedule, but we thank the Lord that we find really a very good schedule for this webinar. So again, thank you, Ma'am Tracy, and the rest of the group, your classmates, and of course, the masteral students of PWU and this batch, right? This group, who is sponsoring this webinar. Please allow me also to acknowledge Professor Dr. Mark Santos, all right? And of course, Dean Professor Dr. Minerva De Ala, other faculty members of Philippine Women's University and the Graduate School of Nursing, guests, friends, ladies and gentlemen, good morning. Okay, so my role or topic this morning is to share my insights on the trends in nursing for 2023 that is focused on critical care nursing. Okay. All right. So disclosure, I do not have no conflict of interest related to this presentation. This is done, this is presented to you as part of your learning activity. All right. I have shared this previously, in my previous talk, but I would like always to share this before I start. Please allow me to read. When a person decides to become a nurse, they make the most important decision of their lives. They choose to dedicate themselves to the care for others. And I know this is us nurses. So we thank you, that despite of the out migration and other issues, where we are still in the country, serving our countrymen, and we hope, that we'll continue to stay even after our graduation from the master's degree, and share, of course, our care, the Filipino way to our countrymen as well. All right. The objectives of this presentation, which was earlier presented by one of the committee members, please allow me again that we will be discussing the topic in this manner. So we will be focusing on the challenges in trends of critical care nursing. Of course, we'll focus on the required competencies and staff development in critical care nursing. All right. The outline of the presentation is as follows: the introduction, challenges, the staff development, and specific competencies. In the challenges in critical care nursing, I place a subtopic that before we look into the I mean, critical care nursing itself, I think it is very appropriate to look at the state of critical care nursing in the Philippines, because we have also challenges, no, that we need to know. And before we will go to the future of critical care nursing, which gives us a lot of challenges at this time. Okay, so we are ready to proceed with the lecture. I hope I am clear in this webinar. Okay, let's start. Okay. Let me start with historical considerations. Let us see how first critical care started in the early times. So in 1854, during the Crimean War, of course, Florence Nightingale, right, enacted one of the first principles of critical care by placing the most seriously injured patients closest to the nursing station to allow more attentive monitoring. So it was very something very challenging, that our dear Florence Nightingale has cohorted patients, which I know we are doing this also at this time. So going back, so we are going back to this activity. So, well, it was so surprising that this principle was already done during the early times and signifies the start of critical care. And in early 1950s, the polio epidemic and the advent of respiratory care units for polio patients confined to iron lungs, that critical care emerged. Then after early 1950s, so in the late 1950s, we have two known individuals, Max Whale and Herbert Shubin in Los Angeles and Peter Safar in Baltimore, created the first ICUs. And since then, since the early days, here comes ICU organization and critical care practice that has evolved extensively in the environment. Then critical care clinicians have adapted to emerging science by implementing new techniques and have changed clinical practice when accumulating evidence failed to support previously accepted theories. So these are the historical considerations for critical care. So we are so really amazed how far critical care is now at this time. So, well, we talk about critical care nursing, so we have to highlight the critically ill patient. And the critically ill patient, in the ICU, of course, as you see in the photo, remains the focal point of critical care, regardless of ever-changing care practices and delivery, the pasts and the future. Okay? All right. So, well, I know that in critical care, we must have teamwork. And teamwork comprises of the different individuals who provide care, who assist care to the critically ill patients. To name all of this, these are the intensivists, the physicians and subspecialists, the pharmacists, the physiatrists, nutritionist, dietitian, therapist, and most of all, we nurses who are with the patient 24/7. Okay, so now let's talk about the challenges in critical care nursing. All right, before I proceed, may I know in the group who are ICU nurses? Are there a few of us, or all of us? All of us in the group are ICU nurses. But anyway, this is our ICU here at the Medical City, and this was my home for more than 10 years. And I'm very grateful, that I was honed here as a, let's say, as a very responsible, competent ICU nurse or a critical care nurse. I remember that during my early days, when I was just a staff nurse, I really don't, I mean, ICU or critical care is not my field of interests, but there was no vacancy, at the operating theater that time. One of our nurse managers talked to me and said that there are no vacancies at the operating theater, so I will be assigned in the ICU. Honestly, I got feared in the ICU because, of course, we all know, that the ICU is a complex environment. Why well, when I first entered the ICU, there's a lot of, of course, a lot of critically ill patients with a lot of contraptions, a lot of equipment, a lot of noise, all right, and bright lights that is coming out, coming out from the technologies inside the ICU room. These are the pumps. These are the feeding pumps. What else? Cardiac monitors and other care modalities. Okay, so of course, this is our topic today. So we have to go inside the ICU, and really find out what is happening inside the ICU. It was introduced a while ago, right? That we won in a contest on patient safety about hand hygiene. So I think this is one also of the inspiration of our hospital, that we really placed something inside the ICU to keep us reminded that all of us entering the ICU, there are no exemptions, that we need to do hand wash for patient safety. All right. As I said, before we go to the other challenges in critical care, we have to also look at the critical care nursing in the Philippines, because there are also challenges in the country in the practice of critical care nursing. All right. And of course, I would like to laud our Critical Care Nursing Association of the Philippines, CCNAPI, because they are very dynamic. I was once an officer and a member of the Critical Care Nursing Association of the Philippines, and really, they are really very dynamic, robust, really, in the to really keep keep the practice of critical care in the limelight. All right. So to start with, the World Health Organization, WHO 2012, released an analysis of human resources for health in the Western Pacific region. And with this, there is really a demand for safe and quality care from qualified professionals across healthcare settings. I know that this is now one of the challenges that we are facing with the nursing shortage, right? Qualified professionals who will really provide care to our patients in the ICU. Because I know these professionals really contributes to safe and quality care. Without qualified professionals, competent professionals, then there would be a problem or a concern that may rise later on. But I know with this qualified professionals, the health human resource is one of the challenge that we face today in critical care nursing. All right. To continue, factors that influence nursing workforce in the Philippines are out-migration. It is very obvious, right, that a lot goes out of the country, not just ICU nurses, but a lot of nurses on different areas of practice. But I know ICU has an increase in net worth. That's why we are ICU nurses. We are easily easily accepted abroad. And I know with the deployment cap of 7,000 a year, I think that's that's a large number that would affect really our number. So issues in quality of education, all right. Problems in the work environment that increase workload. So this was by Romualdez et al. In 2011 and World Health Organization in 2013. Likewise, according to the International Labor Organization by Lorenzo et al. In 2006, majority of the nurses who left the country to work abroad were well trained. Of course, in specialty areas such as the ICU and the CCU or the coronary care units, with majority having 1 to 10 years of experience. Really, it feels me very worried, when a lot of ICU nurses really resign, because I know that they are really very important, of course, in a hospital, in a level 3 hospital, which has ICU beds. So it is obvious, that leaving the country by experienced ICU nurses would lead to the depletion of experienced nurses who could have provided quality care and mentoring to new nurses in critical care. Okay, because I know one of the roles of an ICU nurse is not just a provider of care or in the practitioner role, but also an educator. So, well, if they leave, so we also will get concerns also in training, in educating and training our new nurses in the ICU. All right. How do we become an ICU nurse in the Philippines? So of course we all know that the entry point to become a nurse in the Philippines, of course, we finished the BS and we finished our bachelor's degree, and of course should pass our the nurse licensure examination. So after that, the PRC Board of Nursing recognized specialty organizations and the DOH to develop comprehensive nursing specializations. So with that, as I said, one of the specialty organizations in the country, which is CISINAPI, is the one providing training for critical care nurses. And as well as let us also look at the DOH, because they also provide the nurse certification program with 13 specialties, that is cardiovascular, renal, emergency and trauma, orthopedic and rehabilitation, mental health, infectious diseases, pulmonary, maternal and child, pediatric, operating room, anesthesia, geriatric, and gerontology. And I know that we are being, let's say, recognized through a competency-based determination of acquired skills in a specialty area throughout our career. So we look at our competencies, our knowledge, our skills. And I know that there are specific checklists on this that we need to comply. Aside from a specialty organization, aside from DOH, there is also a tertiary hospitals, academic and training hospitals, and other multi-specialty organizations also offering advanced program on a specific critical care focus. I know ECG is always being provided, ECG reading, the arterial blood gases, care of the ventilators, and etc., etc. And also, but still, the obtaining certification and licensure as a critical care specialist is still that is recognized by PRC BON is still unclear in the country. That's why I know in the career progression and specialization program, I know that this being finalized, and we hope soon that soon there would be a clearer policy guidelines on how we will be certified and recognized as a critical care nurse specialist. So we look forward that our specialization program will move forward and be certified soon as a critical care nurse specialist. All right. For the standards of practice, critical care nursing practice standards were developed and updated by CCNAPI, one of the specialty organizations in nursing. And of course, the goal for critical care nurse is to promote optimal adaptation of critically ill patients and their families by providing highly individualized care so that critically ill patients adapt to their physiological dysfunction as well as psychological stress in the ICU. So the standards of practice in the critical care nurse, there's a lot, but I would like just to go through very briefly. So CCU nurse, of course, we have to function based in accordance with our legislation in the country, common laws and organizational regulations, which affects nursing practice. As an ICU nurse, of course, we provide care. This is our practitioner role with to individual patients in the ICU, on a 24/7. Of course, that's why we are on duty for 24/7 on different shifts. It is expected as a critical care nurse, we have to be competent to provide care to the critically ill patients. Of course, we are be guided with ethics, and also we are also expected to demonstrate accountability, for our professional judgment and actions. And we, in critical care nursing, I have underlined this because we also need to take care the safety, and security of patients, visitors, and staff as well. And as a critical care nurse, as I said a while ago, there's a lot of equipment inside the ICU. So we need also to master the use of all this essential equipment, because it helps, in the delivery of care. But of course, no one can replace of course, the human touch. No one can replace the human touch, our human touch as nurses. So available to services and supplies for immediate care of patients. So I know, during the pandemic, we've got really a huge concern on supplies, medical supplies that really affects the delivery of care. So, well, as an ICU nurse, it would be part of our role also to make it available for our patients, and not to have any other negative issues later on. And of course, as we care for our patients in the ICU, we have to protect patients from developing environmental induced infections. Okay, that's why we have clinical indicators, right, for us to be involved and monitor this in our respective units. From being a student to our transition to professional nurse, nursing process should be utilized all the time in a systematic manner to achieve the goals of care. All right. So it's a process. So of course, we start with assessment and ends with evaluation. Aside from being a direct provider of care in our practitioner role, of course, we are educators, so we have to carry out health education for promotion and maintenance of health, right? So, and also we assist, rather acts to enhance a professional development of self and others. Well, to sum it up, as a critical care nurse, I like this. No? I like this definition, no? That as a critical care nurse, we have to anticipate events. No? One who sees beyond than just taking the vital signs. You know, when we are in the ICU, of course, we are monitoring a patient or two patients. You know, in a bit of a second, something may happen to the patient. That's why we must be very attentive to our patients, as well as other factors, no, like the vital signs, because as I said, no, in a bit of a second, something may happen to patients. Response to clinical cues, no. So being an ICU nurse, I think we, in time, all right, our clinical eye, we would be developing our clinical eye, all right? And of course, we just not need to take the vital signs, but we have to analyze it, right? We have to correlate it with the patient. We have to contrast it, no, with the normal values, all right, and collaborate, no, with the other members of the health team, because this, no, may serve as a warning signal that something may happen to our patient. So we need to act fast, no. Time is of the essence in the ICU, all right? Remember, time is of the essence in the ICU, okay? Urgent and always. Aside from assessment, of course, that's why we should be competent, because we are expected to intervene intelligently, right? Of course, before we intervene, of course, we have analyzed what is going on. Okay, we have read precautions. We have read holding orders, if we have to give it or not. So aside from intervening intelligently, we are also expected, all right, to evaluate outcomes of intervention, no? Which is, I'm a little bit disappointed sometimes, because when we intervene, no, pag natapos tayong nagbigay ng ating nursing intervention, sometimes we do not go back, no, to our patients and check, all right, how is the patient. But I think, as I said, no, let us complete the nursing process. So let us get back after a few minutes, checked and validate the patient if our intervention, is has worked or is well already, right? Or the patient is well already. Because if not, we have, you know, to really reassess, okay, and decide, you know, what's next step to be done to our patients. So again, we have to develop that clinical eye, being an ICU nurse. All right. And you know, no, being an ICU nurse for many years, what I have learned, no, is that I never neglect calls or any messages, because I don't know, it may be naturally came from that practice, that it was a habit. Now it becomes a culture to me, no, that someone call or message me, I think I have to respond, no. So I see urgency. So again, I always say, no, that if I did not respond, there must be something wrong, no, because I was used to really that I never neglect calls or anything. So I think that was the takeaway, no, for me being an ICU nurse for many years. And of course, I would never forget those nursing care we have provided to our patients with the 10 years in the ICU. Well, at this time, no, nakakamiss siya, no? Nakakamiss siyang gawin, no? You know, yesterday before this talk, I have to go to our ICU and of course to visit the ICU, immerse myself in preparation for this lecture. And I think the ICU remains the same, but of course has a lot of improvements, in terms of technology, in terms of processes, so which later on we will discuss. So there are really emerging, a lot of challenges, a lot of innovations, emerges, from the time before until now. So as an ICU nurse, we must be ready all the time, and we must have that. We should adapt, to whatever challenges we had in the area. Okay. Part of the challenges of critical care nursing, especially in the country, of course, we all know, staffing ratios is a concern, and workloads, these are perennial problems in nursing and in the country as well. And the nurse-patient ratio, well, of course, we know ideal is 1:1, 1:2, to 1:5, and these patients are, of course, taken care by registered nurses with either a permanent or contractual nursing positions. So, and the only thing, that sometimes I know I am with you, that if there are no patients, let's say, for example, in the ICU nurses are being pulled out to other units and rotated to general wards to augment staffing. But I think this must be taken positively, of course, because as a team, we have to help each other, And I think let's share our competencies, our skills to the rest of the other units of the hospital. If there are no patients in the ICU, because we cannot stay there during the duration of the duty, but we have to join other units and assist our nurses also. And clarity determining the ratio. Yes, all the time we must determine appropriate ratio, because we have to ensure and support a safe staffing practice in the ICU. Okay, so that's why there are endorsements, right? In the ICU, we have a pre-conference before we start our duty, to endorse the patients to the next shift. And with that, that gives us also an opportunity to discuss the acuity of patients, and also decide if we are going to be 1:1 or 1:2. For specialty training, we look at the standardized education and in-service training as issues still in the implementation of set standards of critical care nursing in the Philippines. And well, I know we are a baccalaureate degree prepared RN, and this is the trend that after RN, and after our licensure and after taking some trainings, okay, we can now be in the ICU, because as I said a while ago, the certification is still unclear at this time. So also in our BSN curriculum, based on CHED Memo number 15, series of 2017, so we have an NCM 18, and this is the nursing care of clients with nursing care clients, yes, with long-term care, acutely ill or multi-organ problems, high acuity and emergency situations during senior year of BSN program. And to my understanding, it's said to be that this must be the a preparation for the critical care nursing program. but still, I think this would not be enough because of the limited time, no, that we have immersed, no, during our related learning experience. So that's why I also agree, no, with our specialty organization that once we are in our respective hospitals of choice, no, we have to provide basic critical care training and orientation to newly hired nursing staff. And I'm sure almost all have this, but only in differs, no, with the timeline, because sometimes we need to shorten it, no, to augment staffing. But of course, again, no, we have to evaluate it from time to time and see its impact, because we have to revise it, no, revise it or improve it, no, in case that the current program orientation is not effective. Other issues are availability of competent preceptors and instructors. Well, as I said, because of the out-migration, we need, no, experienced nurses at this time. So they are not here anymore. So it's one of the concern, no? Then another thing is availability of base hospital where students can practice, and also loss of faculty, nursing faculty due to migration. So not just in hospitals, but also in education, no? There is also a migration of nursing faculty. And I would like to just give this to you, no, the Belfast Declaration of 2017. So they included, no, the commitment to globally advance the state of critical care nursing by supporting further development of education and practice in a resource-limited countries. But I think this is a declaration, no, by critical care nursing to really support, no, education and practice, no, of critical care nursing. All right. Based from this author, no, also expressed challenges on critical care practice among doctors and nurses. Again, it's still the same, no, because this is taken from other country or other region. So it's still the same. There are concerns with budgetary needs for maintenance and development, an equal distribution of ICUs in terms of staffing, inadequate medical and nursing staff, needs for specialty training, and also persistent need to address this disease burden. Then, and for critical care nursing practice in the Philippines, as we have discussed previously, so this gives us the summary, no? Again, adequacy and availability of a qualified nursing personnel is a challenge. Accessibility of training is a challenge. Existing positions for practice, unfavorable work conditions, improvements in nursing curriculum to better prepare future nurses for critical care nursing practice, availability of data to inform policy. Later on, we'll discuss about the importance of data, no, in the future of critical care, because this is one, I think, one of our weakness, no. We may collect data, but we do not analyze them. So I think that is one of the I think improvement that we need to do, no? Unfavorable work environment with heavy workloads. Okay. And all of, again, those we have discussed, no, it just gets down again to that what do we need to do, no, as leaders, all right, as leaders in our respective institutions. Of course, to ensure safe and quality care to the sickest patients in our hospital, we have to ensure staff competencies, all right? And also to manage, likewise also to manage the stressful environment inside the ICU. So we need, so this talks on capacitating, right? Capacitating the workforce, right? Capacitating our workforce, okay? All right. For the future of critical care nursing. All right. So the Society of Critical Care Medicine's Future of Critical Care Task Force notes that critical care medicine will be transformed by, so we have three. So again, this is a challenge for us. Why? Because we have to prepare ourselves. We need to learn on this. We have to adjust on this, no? And we have to we have to follow, no, and prepare ourselves. So there are a lot of technologies coming out. So then integration of the AI or artificial intelligence, decision support algorithms, and advances in seamless data operationalization across diverse healthcare systems. So again, it talks about, so again, no, just to sum it up, sorry if you get confused, well, the focus now, the future of critical care, that's technology. Then there is data and data science, and also that artificial intelligence. So this will only be relevant and meaningful, you know, if they improve the very human endeavor of caring for someone who is critically ill. So which means that all of this should integrate, no, and collaborate, because as said, the only way that we could say that they are relevant and meaningful is improvement, you know, the critically ill patients. All right, the future of healthcare will seek to mitigate the current challenges, which I think it's still the same, no, with the previously discussed slides, no. So they are, so which means that our references, no, speaks the same, no, on the challenges. So we must be ready to embrace smart technology, devices, and medications. All right. And I know I have presented this, no, last week also with the PhD students of PWU, you know, because the topic is Sixth Industrial Revolution. So this is a data, no, coming from the journal, no, on or article on the 9 forces changing the world for hospitals. So it says, no, that the patient population is getting older and their needs are becoming more complex. So we expect, no, that there is a need for ICU care. All right. And at the same time, we need also to be prepared, because if the patient's getting older, then we have to increase, or rather enhance, our competencies on gerontology or geriatric nursing. Okay, so we need to increase our competencies in the care of the elders, no, who have complex complex diseases. Then we again, no, the clinical advances, no, is still in the 9 forces. So again, this would really happen, no, and it is really happening, no. Clinical advances are delivering better quality and outcomes, and again, we should get through digital technology. All right, so have begun to affect how healthcare is delivered and have the potential for disruptive change. So it must be part, you know, of our daily routine, no, to be digital, okay, because they are now part, no, in healthcare delivery, or rather part in the delivery of care to our patients. All right, so a glimpse of the future. If that will happen, how do we now envision? So what will happen now? So if that is the case, then from a wearable, non-invasive continuous monitoring device, who is being, I don't know, who being attached to a patient, I should say. So this will be monitored, no, by our telehealth monitoring center. So because AI is now incorporated, so it now tries to analyze, no, that wearable device connected to a patient. Then during the analysis, of course, he would know that something is happening to the patient, so we can deliver initial therapies, and later on, because it is being monitored by our telehealth, later on, a mobile emergency care team can now be in your house to really check on you and deliver appropriate treatment. So I think we are looking to this one, no, in the future, that as an ICU nurse, then we must be prepared, no, on really how to deal, no, with this advanced scenario. So again, no, harnessing data and technology to impact delivery of care. So as I said, no, acquisition of data is very important, no, to both modern life and modern healthcare. Data, no, is important. So, but I think there must be data literacy first, so that we would understand why we are collecting data, no, and before we'll deal into data science, no. Healthcare data will be harmonized and shared in real time to healthcare professionals deliver precision care to improve both patient and population outcomes. And I think this data, no, this data would be analyzed and now integrate, no, with technologies, no, to come out with a meaningful decisions in terms of treatment and also management. Same as with this pharmacogenomic data on pharmacy, no, that would give patients a personalized medication regimen. Technologies, no, will be leveraged to better track and disseminate patients' social history and treatment preferences, as we have discussed earlier, no. So with this, no, once integrated to technology, so they now communicate with each other. So discussions on pre-hospital setting, no, that this includes the advanced directives, surrogate decision makers, religion, spirituality, cultural beliefs, and preferred coping strategies, no, will be communicated across geographically and professionally diverse care teams, and this will be readily available to inform treatment options. So with this technology-assisted improvements, would really transform critical care. Okay, now we see that in the future, all right, this would be the ICU team, no, that would look like, no. So towards a more patient-centered care team and environment. So we see here that the ideal state, no, of the future care team within a learning care environment. So care team is defined, no, as healthcare professionals and family or relevant support system. And the family or relevant support system comprises individuals who can provide comfort to the patient outside of healthcare staff, and may include direct family, friends, significant others, and or religious leaders. And healthcare professionals, this includes physician, advanced practice providers, nurses, pharmacists, nutritionists, social services professionals, spiritual leaders, and physical, respiratory, and occupational health therapies. So you see here, this figure, no, presents an integration of all these aspects, no, that the care team, together with the complex therapies and the complex environment, all right, interloop, no, with each other towards a more patient-centered care, no. And of course, no, around that is our data gathering, no, that could really help analyze all those aspects coming up, as I said, no, with meaningful data as part of treatment and management. And this new paradigm or representation of the ICU care team and the environment is also aligned, no, with the healthcare ecosystem I have previously presented, no, as previously presented before, no, and this was released prior to the pandemic, no, and this was the next wave of healthcare innovations. So you see in these healthcare ecosystems of the future, we see still again that the patient, no, that the care is centered on the patient. So you see the data, financial data, social structure data, the provider generated data, health and wellness data, patient generated clinical data are all directed to the patient. So again, one of the competencies, I guess, no, of us is to really go into data science. We have to keep ourselves, or rather capacitate with with data informatics and analytics, no, because it is now the current trend that is happening, and I was so amazed, no, that because this was released prior to the pandemic, all right, then it has, I don't know, it has given us that this became true, no, because we went into integrating home, near home, and virtual care services, no, because during the pandemic, all right, that during the pandemic, I should say, no, a lot of virtual services, no, came into birth. We have a lot of telehealth, all right, or teleconsult as we see it, or telemedicine, no, came to birth. And also there's also a lot of remote care services that is now being provided at home, no. So if you see, there's a lot of wheels, no, lab on wheels, COVID-19 on wheels, a lot, no. So meaning these were delivered, no, by a different mode of transportation, reaching your home on your own convenience, no. So home health, no, virtual care, and the retail clinics. So I as a critical care nurse, we have to capacitate ourselves and really we have to keep updated on all of these trends so that we will not be left behind. This is as a continuation of the ICU care team that I have previously discussed. It shows that that since we are talking about challenges, so these are also the work challenges for us ICU that we need to be prepared. That in terms of a complex patient, so we expect that chronic comorbidities will enter the ICU, chronic invasive devices, that we need also to learn the technology, out of hospital monitoring, compromised immune status, and etc. With the environment, you see that there's a lot, increasing technology, which is true. Documentation, what else? And I would like also to highlight the danger of alarm fatigue. In the ICU, as I said a while ago, inside the ICU, there's a lot of noise coming from different modalities of care. But I hope that as leaders, we must create ways on how to prevent this alarm fatigue. So it is because the environment is also complex. Of course, we need to ensure an adequate handoff. And okay, what else? Telehealth, and etc. For complex therapies, I know no, that with complex therapies, we need to prepare and also look at modalities of care, no, like the continuous renal replacement therapy or the ECMO, no, which a nurse should be capable, no, of operating it. Here in the complex therapies, I would just like to highlight that we need to maintain patient participation, and at the same time, we need to communicate, no, all the therapies, all the care that is being done to patients, no, that we need to address the concerns, no, of patient, family, and clinicians. And I know we have a best practice, no, in our institution that for a patient with more than three patients, there is a multidisciplinary team that is being done. And I think this is very significant because it gives us a capture what is the status of the patient, and that we are guided, no, what are we expecting, no, on the next days, no. So I think we can adapt it also, no, if we found it very significant. Okay. I think the next as you see, no, in the care team, their patient care, education, and clinical research are interlooped, no, in the figure a while ago. So for patient care, we need to embrace, no, being multidisciplinary, patient and family centered. We must be evidence based. That's why there's a need for continuous research. Of course, for us, nursing research, and also for shared education. I would like to highlight debriefing sessions. No, huddles is very important. Case reviews, burnout awareness, and also competency check, no, is also very important. And part of research, of course, the only way we could say that our care, our ICU is successful, there are measures of success, no, that will come from outcomes, scientific, validated outcomes, no, inside the ICU. All right. So therefore, what are the characteristics of the ICU team of the future? All right. So based on this, journal in the future of critical care, for the individual, okay, we have to think, no, we have to enjoy out-of-box challenges, no. We have to nurture resilience. We have to recover fast, no. Engage in a non-work renewal, okay, values, humanism in care. Of course, no, we have to practice personal wellness, that is well-being, no, self-care. That's correct, no, that in order to provide care, we need to take care of ourselves first, okay? And of course, has ICU personality. My interpretation of this is that, of course, I mean, that's your field of interest, no, because it's easy to work, no. If that's your interest, no, we could contribute a lot, no, in our respective unit. So for the team, we are expected of the team, no. We're expected, no, for situational awareness. We have to encourage each and every one of the team, and also the family, no, should be part of our ICU team. They get involved, no, in the care of and decision of patient care. We are also expected not to avoid wasteful practices, no. Cross training, no, is also emphasized here, no. So multi-professional and collaborative members. So which means that we see now a lot of these specialized individuals joining the team to provide care and contribute to the care of patients. And of course, the team should provide patient and family support and comfort all the time. Well, those our leaders, our executives, of course, must provide adequate staffing. No, they have to support our quality improvement initiatives, and etc. etc. Okay. Okay. So overcoming barriers. I think I need to move fast on this. So again, it was highlighted, no, that here we have to enhance collaboration and communication, no, as I said, no, and we have to deal with the evolving technologies, work with health data, and because what expected of us is to contribute to improve patient care, and also we need also to be part, in the training, of the health human resource in the critical care unit. Okay, so well, what are the role of professional societies in the future? So well, it is expected, that professional organizations should give us, let's say, real-time updates to clinical practice guidelines. Then also collaborative relationships, with critical care professionals and other organizations, and as well as the advocating patients, families, patients, and critical care professionals. So after going through, the future of nursing, the future of critical care nursing, now we look at staff development in critical care nursing. So well, almost all of us, as a critical care nurse, we start with our new employment orientation as a new employee of the hospital, and I know there's a typographical error, program. So I know that we have our own programs regardless of the name or program, that the most important thing is that there's an orientation for us as new employee. Then after that, there's an orientation for us in our nursing department. And if we are going to the ICU, there must always be, again, another critical care program orientation that would prepare us, for that new role in the hospital. Of course, we talk about development. It must not just the responsibility of the organization, but it is also us, individual, to be also taking care, of our personal development, by attending in-service training programs provided by our institution. And there's a lot, this time, of continuing professional development programs, or CNE programs, continuing nursing education programs, that is given, for free. So we just need to really get access of it, and I think let's take the opportunity to learn a lot with this in-service programs, these development programs or education programs, where if there are if there are concerns with resources, I know there's still a lot, of free webinars, or that could meet, our educational needs. All right. As a critical care nurse, I may be biased, because I am focusing here, the practitioner role of the ICU nurse, inside the ICU, inside the hospital, or in the ICU. So well, part of our development, is, of course, we have to join clinical rounds. As I said, a while ago, that the ICU team, I'm happy, that the ICU team that is being looked at in the future, I think we are already executing it here. That's why we have the clinical rounds, in our crit care area. All right. And this is done every morning and in the afternoon, led by an intensivist, because our ICU is a our ICU is a semi closed ICU model. So I know in an ICU setting there are we have system operations others are operating it open, meaning the admitting doctor or other attending physicians dictate the management of the ICU patient, and we have intensivists as a consultant. But for a closed ICU system operations, the management is coordinated by a qualified critical care specialist, and the final pathway here is we have the intensivist. So in our clinical rounds, of course, the team round all patients in the ICU and discuss the status and management, and they are joined by the team of doctors, the intensivists, residents, interns. We have pharmacists, of course, the nurse is there, or rather the nurse in charge is there, and other members of the team. Of course, as a nurse, we are expected to join the clinical rounds, learn from the exchanges, and of course, also articulate the status of our patients. Okay, I think as an ICU nurse, we should not miss that part, because I have learned a lot during that rounds when I was in the ICU. Okay, and of course, as ICU nurse, we must involve actively in quality improvement initiatives. That must be our culture as an ICU nurse. All right. Well, it was said a while ago, that when I was in the ICU, we were awarded the patient safety for the automated technology with hand hygiene. So as you see in the slides, we have before the ICU, before you enter the ICU, there is a signage, right? And you can also see at the left side that there is a footstep, so you have to be there and have the hand hygiene before you enter the ICU room. That is monitored by an RFID and before you enter. So meaning it captures one of the moment of hand hygiene, which is before entering the ICU room or the patient's room. So that I mean, we're happy that we are recognized with this quality improvement, with increasing our compliance to hand hygiene by use of technology. And also in ICU nurse, what's new also in ICU, we now have the critical care pain observation tool. So it is now part of the monitoring, aside from vital signs, the regular vital signs, aside from the other scales that we use. If we are in a neuro ICU, we have the stroke scales, the national the NIHSS, National Institute of Health Stroke Scale, and other tool that we use to monitor patients. So I know as an ICU nurse, there's a lot of tools that we are using, that we should be familiar of it. And of course, we have also like this, the turn clock inside the ICU, because of course we need to really turn patients, because of course we have to prevent occurrence of pressure incidents inside the ICU. All right. Okay. Of course, as an ICU nurse, as we move up, from the bedside, we are given additional responsibilities. ICU nurses respond to code white as rapid response. This code white is a code white team, is a team that responds to a patient that there were some alterations or deviations in his vital signs, for example, or something that had happened that has not coded, no, because the purpose here is to prevent no occurrence of resuscitation, meaning in view before it happened, we have already recognized, so we have to call a code white. It is expected no that if you have responded well, it may not proceed to a code blue, but there are some scenarios still that if code white is not successful, it responded to a code blue, or we have to resuscitate the patient. And also part as an ICU nurse, if you are now senior, okay, as that is our ladder, you now become an ECG nurse in the ICU central station. So as you see, no, in the picture attached, as an ECG nurse, you have to really monitor the 27-bed ICU ECGs of our patients. No? But of course, you will be there are alarms. So therefore, if there are alarms, as we said a while ago, is to avoid. We have to never neglect alarms. No? So we have to check, no, and validate what is happening to the patient. Of course, because ICU, no, has a lot of modalities, we must also equip ourselves, no, with on how to operate the continuous renal replacement therapy and the ECMO, as we said. All right. This study, no, by Santana Padilla et al. In 2019, no, has supported, no, our claim for the staff development in the ICU. No, it says, no, that solid knowledge and skills are required to care effectively, no, in the ICU. So it would be never-ending training. So a continuous training is necessary. No? And the clinical field provides the reality of the ICU environment and the needs for different types of patients. So immersion, no, in the actual ICU environment would really keeps us appreciate, no, nursing care. Of course, the competencies of ICU nurses in the healthcare environment have increased new responsibilities. That's correct, because it is associated with new care, new programs, and also devices for the critically ill patients. So if we talk about devices, we may look at some technological competencies, no, that we have to check. As leaders, no, of our respective ICUs, we need also to look at, no, the needs of our nurses from time to time, because we have to update that, no. We have to update that, no. We have to capture those weaknesses because we have to check on them, no. But once it has improved, shows significant improvement, no, in the list of competencies, then it would be it is okay, no, to because of high volume. I know, no, because of high volume procedures or skills, we will be sharpening, no, our respective competencies, no. But of course, after we gain that competency, I think we do not need to repeat it from time to time, but it may be removed, no, and have again another skills, no, that we need to check, because if we do not remove it, then we will be piling up a lot of competencies to check every year, no. And of course, again, the ICU care team, the multidisciplinary team should be highlighted, or must be highlighted in the ICU, and they should be promoted and supported inside the critical care environment. So this is nearly to the end of my lecture, no. So the specific competencies in critical care nursing, well, we define competencies as the ability to do something efficiently. So we say that competence, again, it is an interloop, no, of knowledge, attitude, and skills, no. So that's competence. So as an ICU nurse, we have general competencies and we have specific competencies. With, of course, general competencies, no, we must have this because wherever we are as a nurse, I think we have the same general competencies. But for ICU, we have really specialized competencies that we have to enhance, no, and enhance and keep ourselves checked. Okay, so we have competency skills check, no. Then we have here competency skills for procedures and also competency skills for technology. So I think, no, this must be done to really keep, no, our human resource in the ICU well equipped, no, and we are assured, no, that they know how to do it because it relates to quality and safe patient care. All right, so this is an CRT machine just to show you. All right, so from CCNAPI, okay, so another, no, competencies, no, that an ICU nurse should have is we have to immerse ourselves with the advanced clinical assessment, and also we have to also learn on palliation or palliative care. All right, so as part of our specific competencies in ICU, because of the healthcare advancement, which I keep on mentioning a while ago, we must also look at having our competencies on data literacy, data science, health informatics, and analytics. Okay, we have that digital competence, and this is a game changer, no, at this time. So the digital and technological competencies because of the new device that is being part, no, of the ICU care. So we have to look on the use of informatics and technology, and of course the fusion and amplification of emerging technologies, the AI, automation, and robotics. Okay, I have presented this on the last webinar, but again, I would like also to share to you from the World Economic Forum that aside from those clinical competencies, no, we need also to have the following competencies to deliver, no, our roles and functions in the ICU in relation to the Industrial Revolution, no. So we have to, as nurse leaders, no, we have to capacitate ourselves with these competencies as well as our colleagues, no, in the ICU. Complex problem solving, coordinating with others, people management, yeah, that's very important, relational management, critical thinking, negotiation, communication control, service orientation, judgment and decision making, active learning, and creativity. And in Levan in 2012, it may be the same, okay, but he focused, no, on 4 competencies. This is critical thinking and problem solving and communication, right? Communication is really very important, no, and mostly errors are maybe attributed to communication. So we have to take care, no, of our communication loops, no, in the ICU. So collaboration, the never-ending collaboration, and of course, as things keep advanced, okay, we must also imbue creativity and innovation, okay, so that we will not be left behind. All right, I think that's the last slide. These are the references of the talk. And let me end by saying this. As a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients. They may forget your name, but they will never forget how you made them feel. Therefore, a truly amazing nurse in the ICU is hard to find and impossible to forget. So thank you very much. Thank you for your kind attention.
Wow, thank you so much, Mr. Ferdinand D. Aganon, for that informative and comprehensive discussion about critical care nursing. At this juncture, we will now proceed to the open forum. If you have questions or comments, please type them in our chat box. I will be reading the questions and Mr. Aganon will respond to your queries. Comments, please type them in our chat box. I will be reading the questions and Mr. Aganon will respond to your queries. Okay, so I have will be reading the questions and Mr. Aganon will respond to your queries. Okay, so I have a question na po na nakita dito sa ating comment section.
Sure.
So from Sir Hero, can you cite or share on what are the strategies and challenges to recruit or maintain specialized nurses in the field of intensive care or critical care despite nursing shortages?
Yeah.
Mr. Aganon.
Yes, ma'am. What we could do what we could do with our ICU nurses is we have to really emphasize or highlight their value in our respective units by focusing or investing on their professional development, on their career growth and development, because I know while they are here in the country, of course I think education really plays vital role in their growth and development, and I think that's one good strategy because investing on them as health human resource is really very really highlights that we value them as a part of the healthcare team of our ICU. And of course, aside from that, we must let them feel that they belong to the in the ICU. They belong to the group. So another from education, we have to really highlight a very good work environment, relational management inside the ICU, and aside from making them feel that they belong and they are secured in the ICU, another thing that we could do is on their career path, they could be leaders, excuse me, yeah, they could be leaders, in the ICU. So they may take additional roles, expanded roles in the ICU as part of their career, ladder.
Thank you, Mr. Aganon. Thank you, Mr. Aganon, for your very comprehensive answers. Okay, so another question, Mr. Aganon, from Ma'am Flor de Lisa Canlapan. Ma'am Flor de Lisa. Question, Mr. Aganon, from Ma'am Flor de Lisa Canlapan.
Hi, good morning.
Ma'am Flor de Lisa.
Good morning. Can you hear
Sir,
me?
Mr. Aganon.
Yeah, can you?
Yes po.
Ma'am Flor de Lisa Canlapan.
Hi, good morning. Can you
Ma'am
hear
Flor de
me?
Lisa.
Yes,
Good
can
morning.
you hear? Yeah, can you?
Yes po.
Yes. Okay. First and foremost, yes, can you hear? First and foremost,
Yes.
good morning and
Okay.
thank you so much for.
Yes, can you hear?
First and foremost,
Yes.
good morning and thank you so much for.
Yes, can you hear?
It is a very enlightening and very inspiring presentation, sir.
Thank you,
And-
ma'am.
And I would like to commend the ICU nurses, not only in adult nurses but in all age continuum of patients, like in the pediatrics or in the
Yes.
neonatal or
Yes, ma'am.
in our chronic, I mean our old patients.
Yes, ma'am.
Sir, really you have delineated the requirements in terms of academic, requirements and skills for our nurses in the ICU. The standards of practice are really excellent, as you have shown us, and even the future in terms of competent nurses. And of course, nurses in the ICUs have special abilities in terms of looking after their patients, because we cannot refute that we have special patients in the ICU. Now, during the pandemic, as part of the administrative staff, I have observed that ICU nurses were not able to have this, in services and updates of knowledge at that time. It was all quick, in order to be able to cope with the new patients that we have. So from the administrative point of view, what do you think is, in addition to what we have learned from you right now, in terms of improving, the wellness and the psychological, support to the nurses? Okay, what is being incorporated into our current new, I would say, standards that you have presented to us? Don't you think that now, while witnessing the pandemic, I have changed my insight of how we're going to take care or how we're going to train nurses. One example, for example, is mentoring, the way we mentor the novice nurses. So, sir, what do you think should be, do you agree that this environmental part, the human part of the nurses also be highlighted in those guidelines?
Yes, ma'am. I agree with that. No, that we have to really highlight the value of human resources in critical care, because of course, we are there at bedside for 24/7. So we have to highlight our contribution. And other healthcare professionals should really look at on how have we contributed, to how contributed to the outcomes of our patients in the ICU, because without us, of course, it will not move forward. So aside from investing on education, as we said, I think we need also go to highlight also relational management, with our team, ma'am, and with relational management, I think we'll be able to really capture also their personal concerns, work with them, and with that, our presence as leaders, or leadership presence, is also very important, that we are always there with them to support them in terms of these challenging times. That's why during the pandemic, if they are really there at the a bedside, no, of course we leaders are also there supporting them and also providing care, no, with the patients, no. We have left our offices and we are at the clinical area also as part of the augmentation, no, for the staffing, because during the pandemic and even at this time, no, there are really challenges really, no, with the staffing, no, inside the ICU. So I agree that in the guidelines we have to have a special part on health human resources that is to highlight the value and contribution of ICU nurse in all areas of ICU, no, and we must be regarded for that.
Yeah, thank you so much. Alam niyo
Yes.
po why I asked that?
Opo,
May
ma'am.
konting kurot pa po sa puso ko when it comes to like recognition of not only ICU nurses,
Lahat po.
lahat in general,
Yes,
ang
ma'am.
recognition during the pandemic. Merong konting kurot pa kasi it has not been, talagang nabigyan ng at least recognition, no, how I still
Yes, ma'am.
kaya
Yes.
yun lang, sir.
Yes,
And
ma'am.
it's really good lecture, sir. Really
Apo,
good. Very good. Thank you so much.
Salamat, ma'am. Ma'am, maraming salamat po, no. Siguro I must be biased because I only say ICU nurse because this is an ICU lecture. But with that po, all of us nurses, whether where we are, we played very vital, a remarkable task during the pandemic. We are at the front line, and we can say that really we are the bravest and the kindest healthcare workers during the pandemic and at this time. So all nurses, regardless where we are, we deserve a salute.
Yes, sir. Thank you. I'm working in Saudi Arabia.
Yes,
Have a
ma'am. Hi.
good day, sir.
Hi, ma'am. Yes, I was there before in King Fahad, no, in Riyadh. So hi, regards po sa ating
Hi, I'm military hospital, sir.
yes, ma'am. Regards po sa ating mga kababayan po dyan. It's nice also working there, but I went home, no, dito po and serve the country po. Yes, regards po sa atin. I know Filipino nurses are well regarded in Saudi Arabia. Yes.
Thank you, sir.
Yes, ma'am. Regards po and take care po, ma'am. Take care po kayo dyan.
Thank you.
Yes, ma'am.
Thank you again, Mr. Aganon and Ma'am Flor de Lisa. That concluding our open forum. The topic is really interesting, but still, there are lots of questions in the comment box. However, we need to end up our open forum due to time limitations. So, all right. We hope that your questions, the 2 questions, were addressed. Thank you to those participants who actively and willingly asked their questions regarding our topic this morning. Let us proceed with the awarding of the certificate. To award the certificate, may I call in Ms. Tracy Kasubuan?
Thank you, Ms. Rose. The Philippine Women's University hereby awards this Certificate of Appreciation to Mr. Ferdinand P. Aganon in grateful and sincere gratitude for his selfless and commendable service rendered as the guest speaker during the conduct of webinar entitled Trends in Nursing 2023, Updates in Critical Care Nursing, given this 3rd day of March 2023 at the Philippine Women's University, Manila, Philippines, signed by yours truly, Tracy L. Kasubuan, the overall webinar chairman, and Dean of School of Nursing and Arts and Science, Dean Minerva B. De Ala. Thank you, sir.
You're most welcome. Thank you. And to the rest of the team, thank you po.
Thank you so much, Mr. Ferdinand Aganon. And thank you also, Ms. Kasubuan. Now, to give us an icebreaker, may I call in Mr. Ferdinand M. De La Rama, Emergency Room Nurse at Methodist Germantown Hospital, Tennessee, USA, and Ms. Jasmine M. Baniked, Emergency Room Nurse at Valenzuela City Care Medical Center.
Good morning, everyone. Before we end our program, we'd like to get everyone comfortable with playing a game. For the lucky 3 winners, you may send your GCash number to Miss Demission. Her number is 0947-711-3688, or you may chat your numbers at the chat box below. Okay, let's start. We name this game Brain Teaser, Name the Place in the Philippines. Mechanics of the game: flashed in the screens are the pictures as clues by putting it together so you can guess the place in the Philippines. You're given 10 seconds to analyze the answer and the picture. Good luck. Okay, let's get started. The first slide. Okay, I think someone got the right answer. The right answer is Tagaytay. Okay, I think someone got the correct answer again. The correct answer is Bicol. Next slide, please. Okay, the last question is Bulacan. The last answer is Bulacan. You may the lucky 3 winners, you may send your GCash number to Ma'am Lisa Demission. Or you may chat your names at the chat box below. Thank you.
Okay, thank you, Mr. De La Rama and Miss Baniked, and congratulations to all the winners. Don't forget to send your GCash number to our comment box so that we can send your prize. Every program shall come to the end, And to formally close this endeavor, may I call in the president of our class, Miss Tracy L. Kasubuan, for her closing remarks. Let us give her a big round of virtual applause.
Thank you so much, Ms. Rose Ann Hilao. I would like to express our gratitude and our sincere appreciation to everyone who worked hard to make this activity a success, and to the PWU School of Nursing, who continually sets new objectives for us to meet, and for the opportunity to be able to conduct a very informative and up-to-date details about trends in nursing for 2023. To our Dean of the School of Nursing, Dr. Minerva De Ala, our webinar advisor, Sir Mark Santos, for continued support and for leading our class, to the PWU IT department and the multimedia department, which is very helpful with regards to the technical issues, and to our classmates who have contributed to this achievement despite the distance. To everyone who spent with us, and all the attendees who have shared their valued time and took the opportunity to learn with us through our program. And last but not the least, to our resource speaker for today's webinars, Mr. Ferdinand P. Aganon, for the knowledge he has imparted to all of us who are present here today. Truly, his expertise helped our today's activity in a meaningful one. Rest assured that these learnings will be a source of guidance and be shared through our professional lives. Once again, thank you to all of you, and have a great to all of us.
Thank you, Ma'am Tracy. So, all right, reminders, participants, don't forget to accomplish the evaluation form by clicking the link provided by one of our organizers or scan the QR code provided in our presentation. Take note that no evaluation is submitted, no certificate will be given. We will not be closing this platform right away, so you will have ample time to finish answering the evaluation form. At this point, let's all watch and listen to our Philippine Women's University hymn. Let me end this webinar with a quote from Brian Albert. The capacity to learn is a gift, the ability to learn is a skill, and the willingness to learn is a choice. This has been Ms. Roseanne Gutierrez Hilao, your Master of Ceremonies. Once again, thank you for attending and have a blessed weekend.